All right, so good evening, everyone. So my name is Petra Haven, and I'm the Executive Director for the Bahamas Anti-Doping Commission. And I am here with Jenna, and she is the owner of Finesse Motion Therapy. So I'm just gonna read a little bit about Jenna, and then we're gonna get started today. So Jenna has been a licensed and registered physical therapist in the Commonwealth of the Bahamas for 4 years. She's a graduate of Bethune-Cookman University, the great Bethune-Cookman University. And she also attended the School of Physical Therapy at the University of the West Indies. So like I said, she is the owner of Finesse Motion Therapy, and she believes in function, health, fitness, and wellness. And it's everyone's business, and she is passionate about public awareness and the education of physiotherapy. So to advocate for physiotherapy in the Bahamas, she teamed up with her colleagues and is the co-founder of Pop-Up Physios, Pop-Up Physios, which is a nonprofit organization that advocates for physiotherapy in the community. So she just recently had the opportunity to be a part of the medical team for Team Bahamas, and she traveled with the Bahamas Aquatics team in 2019 for Carifta, CC Can in 2019, as well as the Pan Am Games in Lima, Peru. So I'll just let Jenna talk to you for a few seconds, and then we're going to get started with our session today.
Hi guys, hi everybody. I just want to come a little bit closer.
There you go.
Good.
Let me put it back down.
Ready? So today I'm going to talk about resistance bands and function. So just a quick breakdown first. A resistance band, what is it? Because I know you guys have seen it in the gym, as well as in rehab, if you've done rehab before. It is a lightweight, this one isn't, but it's a lightweight elastic band which induces muscular contraction. Contraction motion, contractive motion. It builds strength in muscles as the user pulls against it. Okay, so that's why we use it. Now, it was popular with rehab, but nowadays we use it for rehab as well as fitness training. It's a good candidate for teenagers because when you don't want them to start a gym too early, because if they do, it destroys their growth plates. And so you want to use resistance bands and their body weight to help build and tone muscle. And for the elderly, so because as you get older, your bones become more, they lose its density. And so you want to build strength without putting too much pressure on the bones, that would decrease fractures or breaks in bones. So this is why we use them. And it's used for sedentary persons or persons who just like to exercise. Now, we have different types of TheraBands in my clinic. 1 second. In my clinic, depending on what you're here for, I would use either the TheraBand. This is one type of resistance band. You could purchase these in the sports center, so that's a plug, as well as Bahamas Medical and Surgical Supplies. They're normally our sponsors for our Pop Physio events. And so we just like you to know that that's so you can purchase them. And they have different colors. The different colors are different the weight and the resistance. Then you find these more in the gym, the tube resistance bands, right? You normally would either connect it to something that's more stationary to get maximum use of it. And then we have the loop band. These are more dynamic, but they're not as, you won't be able to use them as well as, or manipulate them as well as the tube or the TheraBand. Okay, so are we gonna use all these today? Now the thing is, the resistance bands, they're so versatile, it's impossible for me to show you as much as I like to, each and every exercise. So we have exercises for persons who aren't able to put weight on their joints. We'll try and get some of that in there. Everything is functional, right? We have exercises in standing. We have exercises in kneeling, in sitting. But like I said, it depends on the patient's or the person's goal, like what we have to achieve. So we know what a therapist would know what exercise to give you in what position. That is very important as well. Because even though it's the light and flimsy, you can hurt yourself with these. So it's important to speak to a fitness, a therapist or a fitness instructor on how to use it, right? So to prevent injury. All right, teacher, you ready?
Sure, and before we get started, Jenna, I guess just tell us where we can find you, whether the physical location is, and then also where we can find you on social media.
Okay, so I'm located 4th Terrace, number 15, 4th Terrace, across from Evangelistic Temple. I think that's off Collins Avenue. That's a pretty good marker. You can call 825-2212, or you can check our website out, finessemotiontherapy.com, or email finessemotiontherapy@gmail.com. And you can also find me on Facebook, finessemotiontherapy.com, as well as Instagram at FMT242. Don't be shy, send your questions. The more you know, the better you can help yourself. Okay?
Okay. Jesus, y'all gonna have me doing these exercises. All right, so let's fix the screen so that we can see everything. Now, don't laugh at me, y'all.
All right. Okay, so the first one we're gonna use is a TheraBand. So we're gonna do some shoulder exercises. What I want you to do, we're gonna step on it. Both feet, just one. This time, this one. We're gonna go forward. Good. There we go. We got 10 reps. This is called shoulder flexion. That's 2. Never let your therapist count 3 because we be thinking about all kind of different stuff. 4. Like the next exercise, we're to give up. 5. Way to go. 6. These exercises. 7. Help with posture. Okay. That's very important, especially for those who work inside offices where you sit down all day. Good. That's right. Okay. Yeah. Let's even it out. Got it? Good.
Great. G.
Good. 2. If you have TheraBands at home, let's go. Get active. Join us in it. Good. 6. Good stuff. 7. Please remember to breathe. Take your time and breathe. Don't hold your breath. Do as many of these exercises. Good. Now, the next one. We didn't finish yet? We really start, right? Right. We're gonna go out to the side. 1.
All right, so same exercise to the side.
Yes, ma'am. Abduction, shoulder abduction. Right? These exercises good. Huh? She look good, eh? She love this exercise all the time. Eh? See? Get your TheraBand, you look like this. Take that. Okay. And come Petra.
6.
Okay. I counted. Good. Any pain with this while you're doing the exercise?
I mean, what is your definition of pain?
So I call it good pain and bad pain. Good pain is, okay, I feel the muscle working. Bad pain is what you're doing to me is going to cause me to go to the doctor or want a painkiller, right? That's how I judge it. Because some people just tell you they have pain, but no, if you're exercising, you're contracting the muscle, you will feel some sort of mild discomfort. But any pain in the joint or the shoulder, it'll also let me know, the physical therapist know, that something is wrong in that area. That's something we need to take a deeper look into, right? Because you want to exercise and you're not doing it correctly, or if you have an underlying condition, you want to address that because you would further injure yourself.
All right, so that's 10 on each side.
Good. All right, let's go to the back. 1, 2, just the shoulder.
And then what do these exercises help do again? So these are
stable shoulder stabilizers, as well as it helps with posture. So you know that we sitting down and be on the computer, and I know people got virtual schooling with their children, you got work to do anyway, and you have this little posture where you on the computer, then it's getting, you like me, you slouch. I get uncomfortable. And after a while, what happens is you're adding pressure, you're tightening the muscles in the front, and you're lengthening and tightening the muscles in the back. And so you get this funny looking posture. So by the time you're 40, 50, you're looking like this. And that ain't cute, especially in the picture. Right?
so
So what they do is they stabilize the shoulder, so time to reach, just the shoulder, there you go. Do not take your time, right? Right. So what it does is it helps with posture. You want to posture with your shoulders and stabilize your shoulders, which prevents injury.
Okay.
Right?
And what if someone does not have a band? What can they use in place of it?
If you don't have a band, I go old school. If you have a can of peas, a corn, you can use those as light weights. If it's a resistance band class day, but you can use those. Okay. Okay. All of that?
Yeah, I did both.
With both. Okay. Good. And now you can either get a partner or to keep it in the hand, wrap it around. Or you can tie the resistance band to something that's more stable, like a door. You could slam it in the door, or if you have something like a post in your home. So what I want you to do, we're just gonna go out, that's abduction. So we're gonna straighten the elbow. Good. Out and in. Good. 2, 3.
Trying to remember to breathe.
Breathe. 4. Do not ever hold your breath during exercise. 5. And take your time. 6, 7, 8, 9, and 10. Another way of doing this exercise, keep the elbow straight, hold it. Keep the elbow straight and pull up. Pull up and up.
This way.
Yes, right? That's another way too. So what I did was just lengthen the lever. So you have more work this way than the other way. That's 5 yet?
A little bit more than 5.
Okay, that's okay. We're gonna switch sides. Good.
So do the last one I did?
Yes. 1. There you go. 2. Remember, if you have pain, you stop the exercise. Either you are hurting yourself from an underlying condition, or you're doing the exercise wrong. Okay? Good. All right. Now, biceps. So, and using therabands too, we can also isolate muscles. So I normally get to isolate muscles with the TheraBand of my athletes. I recently had a swimmer come in, or I had a sprinter, right, come in, and they had complaints about hamstrings. So what I would do is give them exercises specific to their injury, as well as they continue doing their sport. Okay, but today, simply with the shoulders, we're gonna do our bicep curls. Now, if you have a tool band, if it's too easy, just step open with the legs. So we're gonna go up, we got 10. That's too easy, Petra. There you go. Let's go. 1, good. 2, she has a great form, a great posture. 3, keep counting. I just wanna show my live. All angles. Way to go. How you feeling, Petra? You breathing?
I'm breathing, definitely.
Good. Keep breathing. That was my 10 already?
Yes.
Oh my goodness. Y'all, she on the road. All right, you're gonna continue stepping in. Now we're gonna do our chest. So, like I said, most of these are all of them are functional, but I'm gonna combine muscle groups. So we're gonna go up all the way. It's gonna reach the things, right? So you need that strength to pull. Good, and down.
Okay, so
Up
there.
and all the way up. 2, good. There you go. Good. 3. Like I said, this goes for young kids as well as middle-aged and seniors. You want to keep your seniors nice and healthy and fit. It gives them a good quality of life as well as longevity. Because you want to be able to, for Grammy to go to the cupboard and reach for something and be able to bring it down, right? You don't want any accidents. So they need the strength, they need the durability, the balance to do all of this. TheraBands come in very handy with just everyday function. That's our 10?
I think so.
Oh gee, today don't let the therapists come until I start over. Using my clinic, start over. You know, I know. Okay, let's go to the core. Right? So, can you use this? You can, like I said, use a partner or put it against a pole. You're gonna come here, one foot in front of the other, and you're gonna turn. Trunk rotation. right? Engage that core, keep the core engaged, tighten up the core. So everybody who wants sculpt bodies and want sexy figure like Petra, do these things. It's easy. It's easy. Another fun fact about the TheraBand, you can use 2 hands. Because I mean, that's you there, and you got it.
So what is this exercise called again?
This is called a trunk rotation. So brace and pull. Good.
And then what is this good for? Sexy bodies, you said?
Yeah. What would you say? What do you got?
Okay. So from an athlete's perspective, what part of the body does this work on?
It works your core, your obliques.
Okay.
Right? So it strengthens your obliques. So you see persons who about work. That same motion you do, and when they swing, they have to rotate their body.
Okay.
Baseball players, right?
So this is good for golf. This is good for baseball.
players.
Okay.
General fitness is best, because remember, persons, male and female, we want to tune our body.
Okay.
Right? So it's a good tuning tool too. This is really good for tuning as well. Right? Without impacting the muscles with weight. Now you got to turn around and do opposite side, so like a balancing touch. So, ready? I guess I just watch the posture, right? All of these are correcting or enhancing her posture. That is very important as well. You want to stabilize and balance the muscles when you do perform your exercise. That's why posture and doing the exercise correctly is very important. It is key. Like I said, the thing about this too, it's lightweight. You can do this at home. You can do this in your office. You know, you can do it on vacation. You could take it anywhere with you. Anywhere with you. All right. Now, let's go with the kneel curl. So I'm gonna put this there.
And so if someone doesn't have obviously this apparatus at home,
Right.
what can they put this on? The door?
Yeah, the door, or if you have a post, because some of us have posts at home,
Okay.
a door knob as well. Anything sturdy, right, will not move. All right, give me a minute. Protect your knees.
Yes, please.
Right, so those who have bad knees, if you have exercises in kneeling position, what you want to do is pad underneath your knees. Okay, so you need to hold it like this. Because like I said, this one. Oh, another thing. This is a light band, and different exercises in different positions require you to either decrease the resistance of the band or increase. So there are 3 normally used in the clinic, as well as they sell it in 3s in the store. So you have light, medium, and heavy, and it goes on to extra heavy, but we don't use that, right? So this exercise, where she has more control, you would want to up the resistance band. So I'm gonna take this away. I'll put this on the side. It doesn't make sense performing the exercise if you're not contracting the muscles properly. And that's okay. So we'll use this one. Right. You're gonna kneel down. Okay. And it's a crunch. So what you're gonna do, you're just gonna pull down. You're gonna use your abs to pull you down, and then you're gonna use your back to bring you back up.
Okay, so now to go down.
And
How does this work again?
This works your core and your lower back. So bend both knees. Oh. Okay. If you want to, prevent that. So that's where come in. Oh, sorry. Okay, then you do it that. So you want to just gonna get.
So bend, so use your abs to go down.
Yep, abs to go down and your back to come up. Because now we want to do is strengthen the core and the abs using the resistance line. This is just one of many.
Okay.
So here, and back up and then back up. 1. Good. 2.
All right. And then what does this help us do again?
Like I said, so if you have to bend forward to tie your shoes, if you have to get on the floor to pick up something off the floor, if you want to reach underneath, you have to get on the floor. And you need to reach underneath to pick something up, and you got to come back up. You need these muscles to assist with that. Okay, right. Very fairly easy. Fairly easy. Until I give you the heavy band. But I mean, she don't know y'all. Let's go. 1. Let's go. 2. She don't even know what number she was, so you want to start over. She's like the last 10. That's there right there. Yeah, so we do that. So when you go to therapy, keep the count. Word to the wise. Okay, you're gonna lie down on there.
Can everyone see?
Yes. Yeah, I fixed it so you can see. Okay, so it's a bridge. What you're gonna do is take this side here, and this side over here. Lie down on your back. So normally too, this is an exercise we use for patients who have back pain, because it does target for lower back, glutes, and hamstrings. Those are very important when it comes to strengthening for persons with lower back pain. So you're gonna put it right here. There's a hip thrust. Keep these hands down. Good. If it's too easy, you go up higher on the band. Okay. Now, what I want you to do, good. Flatten your back, push your back into the wood. So she's bracing her core and her spine. Now I want you to push up. Good. Keep this down. Down. Good. Up again. So it's adding resistance to the exercises. So that we use resistance bands also to progress persons. I have 3. Good. Try to keep going. Try it. Good. And make it more challenging because once you become a master of the exercise, you can always progress it. So you don't have to go to the gym. If you don't have the time to go to the gym, you can have a little session at home and it's a little bit more challenging. Because the more you do it, the better you become at it. Right? Now don't, like I tell you, don't forget to keep the back brace. Give me 2 more. I feel good. There you go. A little higher. Excellent. Way to go. And keep breathing. Now we're wearing our mask because we're doing a demonstration and we're very close to each other. But when you're home, you need to focus on your breathing while you're doing your exercises and you take your time, okay? Okay, our next set. Hip. We're gonna stay on the floor. So this is where our 2 loop comes in. So some persons too, when we working on hip, as well as lower back exercises, we use the loop band. So you're gonna turn and face the camera on your side. On your side. Good. Bring your legs back on the mat. There you go. Right? And it's called a clamshell. And that's because the movement reminds persons of a clam. That's how it's what it's named. So this is the resistance band. And a resistance to the exercise. Keep the ankles together. And you're gonna open the top. Good. And we're working on your glute medius. That's 2. Good. And what does this help you? 3. It helps with your glute medius, so it gives you better, stronger glutes. So when time to walk, time to run, you got to use these exercises, these progressive exercises, as the person gets a little bit stronger. Because normally when you have pain in your lower back, you have issues with your glutes and your hamstring. If you have an issue with your hamstring, you have glute and lower back issues as well. So it's like a triad, that's what I like to call it. Okay, you count it? Just lock right here. Good. And then flip it over, even it off. Okay. You doing okay? Yeah. Don't worry, y'all. She has water in case she needs it. In case she needs it.
Okay. So
Got it? Same thing. Good. 1, 2, 3, 4, 5. Excellent job. 6. Love the form. 7. Form is important. 8, 9, and 10. Good stuff. Okay, I think that's all for on the floor, right? So I want you to take it. So okay, so you're gonna stand up and you're gonna put it right above your knees.
Where am I putting it?
Right above your knees.
Stretch that.
Yeah, man, it can stretch. It got stretch. It got stretch. Right. So sometimes when we're preparing patients for walking or just general exercise, what I want you to do is step to the side. It's our glute medius again. I want you to feel that burn. Ready? Give me a mini squat. Good. And just step to the side and then go like,
Where my hands go?
Anywhere. Good. Excellent job. Let me know when you start to feel the burn.
Alright.
Okay,
And
good.
then back.
Opposite way, yes. Let's balance it out.
And then what is this? I mean, I know it focuses on back here, but what does this help us do?
Right, so it helps build strength in those hips. But for things like sitting to stand, right? You want to be able to sit down and stand up from your desk, use the restroom, on a bed. You just need the strength to do that. So these are basic, what I consider basic exercises that you could do at home or the office to assist or help with maximizing the strength in your hips. All right. All right, do your chest press and now. That's why we're gonna go here and our squats with it. So everybody likes squats. I love a squat, right? But what we can do is increase or progress it and make it a little bit harder. This is the lightest band. So you're gonna step on the band and roll around in your hand. You face forward, face forward. Okay, make sure you hold it tight. So with the TheraBands that we use in the gym, you make sure you roll it around your hands. You don't want to snap back on you because the two bands, they normally come with handles, so it's easier to maneuver. This is what I would have gotten at a squat center. Okay. Now, what you want to do? Give me a squat, good, and then pull up all the way. One, go down and up. So I'm doing it without the band, so it's not as hard for me to do it, but because I gave her a resistance band, she has a little bit more work to do. Sure do. Okay, what number we on? 6. Okay. All right, she stay right up with me all night. My other comes. She stay right up with 6. Good. Excellent stuff. 10. Say on 10. Good. That's okay. That's okay. That's all right.
Okay.
All right. So you go back to the loop. You can do exercises, like I said, in standing, laying down, or kneeling. Depends on what you want to target. In physical therapy, is more than one way to skin a cat. Different people come in with different problems, whether you are actually fit and you can do the exercise in standing. I wouldn't give you an exercise to do laying down because that's not functional. You are more than able to move around, right? Person who has back pain, I might say, okay, you can't tolerate the pressure on your back by standing, so I give you exercises lying down. But someone who comes in for fitness, Lord help you, we doing everything. Okay, so we could take this and put this around your ankle. So I'll just talk you through an alternative, right? Now what you can do is hold onto me, if you don't have the balance, right? And we're gonna go forward. So normally I give someone like a chair. If you're at home, you could do a chair or a desk, right? Good. You feel that? So we working your hip flexors. Trust me, she going through it. She going through it right now, right? And so an alternative would be laying down on your back, and you can do this because you have less gravity to work through. Okay, let's switch it out. Yeah, that was a lot of stuff, right?
I counted.
That's 10. Oh, that's 10.
I counted. Okay, let's go switch it out. So I can pull into the same thing.
Yep, throw on to me. Or like I said, at home, it would be a chair or a desk in front of you. Okay, or a wall, That's awesome. Trying to help. Good. Excellent stuff. 9 and 10. Good. Now you can go to the side. I might be in your weight, so I'll step on the opposite side. 1. Take that. 2. She ain't in me, y'all. Look it up. 3.
Chop.
Go, Petra. 4. You feel this burn? 5. 6. Good stuff. 7, 8, 9, and 10. Switch sides. Good.
I may need you to come up.
You need to come back. This side we did. See, so sometimes patients have old or chronic injuries, and we still have to accommodate so you can do the exercise properly, right? Like I said, remember, it's more than one way to skin a cat. Good job. Good. Excellent. And now to the back. So what we doing is, we strengthening this glute. Squeeze the glute. Never reach back. Like I say, form is important, okay?
Okay.
You ready? 1, good. 2, squeeze the glutes. 3, that's my favorite, is grow your glute big, AKA your bum. Good. 8, 9, 10. Switch. 1, 2, don't let the band control you. 3, you control that band. 4, so a key thing is to take your time. She is, I'm just saying. And another good thing about the TheraBand is it's versatile. So as you can see, we work shoulders, we work core and back, we work in hips, right? So and the TheraBands cost anywhere from $7 to $30. It depends on what type of band you want to purchase.
Each of the pack.
Depends
Okay.
on where you purchase it from. So like I know Bahamas Medical and Surgical Supplies, they sell it by the pack. And I want to say the most expensive one, maybe $10 maximum. And then if you go to the sports center and you purchase the 3 of them together, it might be a little bit, maybe $12 or $15 versus the tubes. The tubes would be, I think, the most expensive ones because it's more to manufacture those ones. Might be 30 and depend on the brand. That's always something too, right? But as you can see, it's a nice, cool workout, and it's just, trust me, it's just the least we can do because we're timed, and I'm trying to stress out. I the woman who's did 30 reps. So you better remember. Okay, so that was a good one with the hip, right? We had all rotations of the hip, and you can also do the ankle. Sometimes if you have a sprain, you have instability in ankles and knees. Oh, let me show you a new one. It's my favorite, especially when you had when you can't put weight on your knee. You can go home on your bed. So Peter, I want you to sit right here, this way. Trying to get a little bit of each muscle group today, y'all, to show you how versatile it can be. So if you have knee pain, and I specifically say this for persons who have arthritis or you've had an injury in your knee, whether you're an athlete. So I'm trying to let you know physical therapy covers everybody. You don't only come when you're hurt. You don't come after just surgery. You can come for preventative measures as well as when you have your aches and pains, with a referral from your doctor. So what I want you to do, can I see your feet? Yes, I can. You're gonna keep this foot down. I want you to straighten the knee as much as you can. You're gonna work your quads. 1, good. 2, excellent. 3, if you guys can see. 4, good. I notice how she's keeping up posture as well while she does this. Chin slumping over and pulling, right? She has a good posture. Isn't that 7? 9. I missed 1. 10. Good. Let's even it out. 1. Good. 2. 3. 4. 5. 6. 7. 8. 9. And 10. So that was the quads. All of these are good for standing. Put both feet up. Good. There you go. Straighten it. Straighten. Good. Now take one down. Take any one, whichever.
Take it out.
No, don't take it out. Put this foot down. Good. So now I'm going to target her hamstrings while she's in a sitting position because, like I said, it's more than one way to skin a cat. I'm strengthening the hamstrings while she's like literally standing on it, putting gravity on it. Especially if you had like a hamstring injury, like I said, you'd be progressive. So pull it back. Good. 1, 2, as far as you can. 3, excellent. 4, 5, 6, 7, 8, you feel it? 9, good. 10, and you wouldn't think this little band would work you out so hard. but it does, it really does. And like I said, it's inexpensive.
So, okay, I guess, can you tell everyone that's watching what you focus on as a therapist? Like, is it just sports rehabilitation? People come to you for injury prevention? Like, what are all the things you focus on?
All of it. That's why I address it, all of it, to let them know that I don't specifically target one thing. As a physical therapist, we learn a variety of things. We learn rehab. So you come to me with a TMJ issue.
What's that?
That's a temporal mandibular joint. Some persons have issues with that, where they have clicking in their joint, or they have pain by their jaw. We deal with those. We deal with persons with neck pain or injury or after surgery, shoulder, any part. Our job is to get the patient back to a functional status.
Okay.
So we assess them to see what's wrong so we can make realistic goals. Keyword, realistic goals, right? Because if you have a gunshot wound in your spine and at T5, I can't help you walk, but I can help you adjust to your new life in a wheelchair. You can be functional. Someone else will watch you and make sure you're doing everything okay. You're able to do certain things for yourself. Okay. So when anybody comes to us, whether it's an athlete, sedentary person, someone after surgery, you know, you got a knee surgery and you want to cycle, you have a competition, I have to realistically get you back to where you want to be. So it's function. But okay, all right. All right, so that's some of the exercises that you can do. Like I said, keep in mind benefits. The TheraBand prevents injuries, promotes weight loss, and tones your body, improves posture as well as balance, and strengthens targeted muscle groups if need be. Right. Good things about it is, like I said, it's easy to transport, less expensive than gym equipment, and it's versatile. You can target so many different muscles at the same different muscles or different exercises target different things with that one $10 band or less, depending on where you buy it from. Also, remember when you're doing your exercises to breathe. Remember to breathe. Take your time and inspect the TheraBand before you use it, because if you don't store it properly, it does have holes or it does become brittle and it can pop and snap you. Okay, so you want to check that as well. That's very important because that does hurt. So you don't want to store it in humid or sunny places to degrade the material, the elastic of it.
Okay. Right. So does anyone have any questions for Jenna? Anyone have any questions? You can either just unmute yourself or you can send it in the chat. Any questions? Any questions? Did we learn anything today?
I hope some of y'all have little TheraBands and was doing these exercises.
I did learn something. I don't know why. I mean, it was kind of surprising that you mentioned the jaw, because, you know, like sometimes you'll just have that little popping or the clicking in the jaw. Well, I had a procedure done on my jaw like a long time ago, but that's really cool that, you know, that I know now if it gets worse or if, you know, it starts to bother me,
right,
I gotta come now. So that's a good thing.
Or you don't have to wait until it gets worse. You can even have the conversation with your therapist, me, and I'll give you as much information as education and exercise that you can do, so we prevent you coming in, you know, and pain. See, the thing is pain. I don't like when persons have pain.
Oh, well, I don't have pain, thank God, but like I'm like, that's still like really good that you mentioned that, because I would have never thought that, you know, you go to a physiotherapist to help your jaw, but that makes a lot of sense.
Yeah, we cover an array of things. So we're not just in a box to say, oh, when you hurt yourself, come to us. We're here for any type of questions to help prevent issues, any type of questions to promote your functional status. Because take it from me, we all gotta work, we have things to do, you wanna enjoy life too. So if your back hurting, not only can't you go to work, but you can go foreign to go shop.
Yeah.
So
Miss Monique asked a question in the chat. Hey, Miss Monique, how are you? We will definitely have in the chat. We'll definitely have the recording. We'll post it on the Facebook page. We can email it out. I could send it to you in the chat. We'll send the link. There's another question in the chat. Miss Tanya Reckley, I had meniscus surgery many years ago, but after exercise, my knees are painful.
Right, so that then goes down to coming to a therapist, being assessed first to see what the cause is, what the cause of the pain is, so we just want to take some outcome measures to see what the problem is so we can know what goals to make. So earlier in the session, remember I mentioned doing exercises to strengthen the muscles in different positions. So depending on the assessment or evaluation, I'll be able to know where to start with the exercises. So for example, if it's pain, then I could say, okay, let's do our exercise in standing and sitting first. And then we can progress to weight shifting to get the knees used to it, to see what we can tolerate. Because you can go from 25% weight to 50% to 75% to full body weight. So our job is to make sure that we assess these things before we just go ahead and jump into something too extreme for you. It's physical therapy is always customized and tailored to the patient. Because if I have a meniscus tear versus you have a meniscus tear, what I can do, you can't do. I may weigh 300 pounds, you may weigh 20. It's still weight bearing, but it depends. It depends on the patient.
Okay, Deshawn has a question in the chat. If a certain exercise is painful or has discomfort, how can you tell how far you should push it?
Right, so that goes back to what I call my remedy, good pain and bad pain. So the good pain would be mild discomfort, as in, I know I'm working my bicep and it's tired and I haven't used it in a while, versus, oh no, this is really bad. I want to see a doctor or I want to take a painkiller. That's what I normally tell my patients. That's I guess the most related way or safe way for you to gauge if to do the exercise. Because I always tell my patients, even if I give you something to do at home, home exercise program, and it's okay in the gym, but then when you go home, you should know, okay, that's not what we did in therapy, so it should not feel this way. So you shouldn't push yourself to the point of pain where you're like, yo, this ain't happening. So that's what I try to express to my patients. Yeah.
You're muted, Lael.
Sorry, thank you. Ms. Monique asked if you are doing virtual consultation during this pandemic.
Personally, I don't feel like physical therapy is something that you can benefit from virtually unless it's an educational session. But if it's educational, a phone call or virtual is fine, like a consultation. But if I am to find out exactly what the problem is, I have to literally see and even feel. Because I know if it's tight, you need a release, myofascial or a deep tissue. You need some sort of pain relief before you can even do the motion I want you to do. You won't even want to do it. But educational or consultational, that's fine. That's fine with me.
Okay, yeah, she said educational, so that's good. We'll have, even if you're not really on the social media platforms, I can pass on her contacts to anyone that has questions, and get her information to any of you that are interested in following up with her after this educational series is done.
Mm-hmm.
So Miss, I'll give you Jenna's information. No problem.
Okay. Do we have any other questions? Anybody else have anything they want to know? If not, going on. Oh, let's see. Where do you recommend persons purchase their TheraBands from locally?
So that would be Bahamas Medical Surgical Supplies. They have a nice section there with the colors of the resistance band laid out with the prices. Like I said, I don't think I've seen anything more than $10. That's the highest value of it. If you do, once you consult your therapist, you know which one to get. Because like I said, certain exercises require certain strengths. Also the sports center too. I also go to the sports center as well. Yeah, sorry, those two. Those two places locally. And it's very affordable. Like I said, nothing more than $30. And the most expensive one would be the tube resistance band. Because it have a little bit more in the box.
Okay.
Mhm.
All right. Do we have any last set of questions? No. Okay. So thank you everybody for joining on to yet another session with the Bahamas Anti-Doping Commission. We'll be doing more of these. If you guys have any suggestions for what we should do on the next couple of runs, go ahead and shoot us a message on our Facebook page, or send us a message at info@Bahamas, A as in apple, D as in dog, C as in cat.org. We'll read those emails and see how we can accommodate your suggestions. But thank you everybody for joining in to listen to Jenna give us an excellent talk on functionality using TheraBands, and for watching me work out and sweat and die. But we made it. We made it. We made it, and it was good, and I do feel good.
Yeah, like shameless plug, if she wants a recovery session afterwards, which is just me calming down all those muscles and stuff so you can get back to functioning, that's me too, $65 starting. So after you exercise, recreational exercise, sports, if you have an ache or pain from the office, come on down, we can hook you up. Education as well, when we can take away that pain.
Perfect. And for those that joined on a little late, Jenna, I guess let us know once again where we can find you locally and where we can find you on social media.
So you can find me on number 15 4th Terrace. That's off of Collins Avenue, across from Evangelistic Temple. My telephone number is 825-2212. And you can find us on social media, Facebook at Finesse Motion Therapy, and IG at FMT242. I also travel to Abaco, so if we have any Abaconians, or if you have any family members who need physical therapy in Abaco, I also travel to Abaco every other week. You can just call so we can set up an appointment as well. Traveling physio. I also do home care as well.
Okay.
Yeah.
Perfect. All right. Thank you so much, Jenna.
Thank you,
It was
Bobby.
such a great time. All right. Thank you,
Make sure
everybody.
a lot of thank yous in the chat. A lot of great jobs, Jenna, in the chat. Make sure to check it out.
Guys, I really
All right.
appreciate you guys tuning in, and questions, ask. And like she said, if you want to see anything, you can let them know, let me know, let us know. The more education, the better. Function and wellness.
Yes. All right. Thank you, everyone. Good night.
Good
Good night.
night.
Be safe.
Good night.